Hello learners. The next chapter is Reproductive System. Objectives. After studying this unit, we will be able to know that various reproductive organs are there, describe their role and different hormones, highlight the physiological changes during pregnancy and lactation, and understand the disorder affecting some problems of reproductive system, different method of contraception and their benefits and limitations, and pregnancy determination test. The reproductive organs of the female and male differ anatomically and physiologically. Both the sexes produces specialized reproductive cells called gametes containing genetical material, genes and chromosomes. Other body cells contain 46 chromosomes arranged in pairs. The gametes contain only one of each pair, that is 23 chromosomes. When the ovum is fertilized by a sperm, the resultant zygote contains the full complement of 23 pairs of chromosomes, half obtained from the mother and half from father. The zygote embeds the wall of the uterus where it grows and develops during the 40-week gestation period before birth. The female reproductive system. Female reproductive organ or genitalia are divided into two parts, external and internal organs. External part performs two major functions, both allowing the penis and thus the sperm enter to the ovum, as well as protection for the most sensitive part of the body from the pathogens which can produce infection. The internal female genitals are the vagina, the cervix, the uterus, the fallopian tubes and the ovaries. First is vagina. The vagina is muscular, highly expandable tubular cavity leading to the vestibular region to the uterus. It is the fibromuscular tubule lined with striated epithelium tissues. It lies in front of anus and has rectum at the posterior part. Uterus. It is hollow muscular P-shaped organ, flattened anteroposteriorly situated. It lies in the pelvic cavity. When the body is in the upright position, it lies is almost horizontal position. Parts of the uterus are fundus, body, cervix. The walls of the uterus has three layers. One is perimetrium, two is myometrium and three is endometrium. What are the functions of the uterus? After puberty, uterus goes through the regular cyclic changes, that is called menstruation cycle, which prepares to receive, nourish and protect the fertilized ovum. It helps to grow the fetus during 40-week gestational period, at the end of which baby is born. The cycle has lasts between 26 to 30 days. It is if the ovum is not fertilized, the cycle ends with the short period of bleeding referred to as menstruation. If the ovum fertilized, the zygote embeds to the uterine wall, which relaxes to accommodate the growing of fetus. It provides the right environment for the embryo and fetal growth. At the end of gestation period, labor begins and it concludes when the baby is born, the placenta is extruded. During labor, the muscle of fundus and body of the uterus contract intermittently. The cervix relaxes. As labor progresses, the uterine contraction becomes stronger and more frequent. Thus, the uterus muscles contracts and expels the fetus and the placenta. Next part of internal organ is uterine tubules or fallopian tubes. The fallopian tubes are a pair of tubes that extend from the upper uterus, extending out towards the ovary but not touching them, through which ova or eggs travel from the ovaries toward the uterus, and which fertilization of the ovum takes place. The end of each tubule has finger-like projections called fimbriae. Structure of fallopian tubes. The tubes have an outer covering of peritoneum, middle layer of smooth muscle, and are lined with the ciliated epithelium tissues. Functions of fallopian tissues: assist to transporting the ovary and spermatozoa. The mucus present in the fallopian tube helps in smooth movement of ova and spermatozoa. Fertilization takes place in the uterine tubules, then the zygote moves to the uterus. Ovaries. They are female gonads or sex glands, lie shallow in the walls of pelvis. The ovaries are two organs located at the end of each fallopian tube. It produces ova. The ovaries produce estrogen and progesterone, the hormones responsible for the development of sex characteristics of the female. Each ovary has attached to the upper part of uterus by the ligament of the ovary. Structure and functions of ovary. Structures. Ovaries have two layers of tissue. Medulla lies in the center, consists of fibrous tissue, bloods and nerves. The cortex area surrounds the medulla. Contains some ovarian follicles, which contains an ovum. Before puberty, the ovaries are inactive, but the stroma already contains immature follicles. Those follicles are called primordial follicles. During the childbearing years, one ovarian follicle matures, then ruptures and releases its ovum into the peritoneal cavity during each menstruation cycle. The process of ovum formation is called oogenesis. Maturation of follicle is stimulated by follicle stimulating hormone FSH from the anterior pituitary. The female reproductive hormones and their target tissue. While maturing, the follicle lining cells produces hormone estrogen. After ovulation, the follicle lining cells developed the corpus luteum that produces hormone progesterone. If the ovum is fertilized, it embedded in the wall of uterus, where it grows and develops and produces the chorionic gonadotropic hormones, which stimulates the corpus luteum to continue secreting progesterone for the first 3 months of pregnancy. If the ovum is not fertilized, the corpus luteum degenerates and menstruation occurs, and the next cycle begins. What is menstruation cycle? It is a series of events that occur regularly in female every 26 to 30 days. The cycle consists of a series of changes that take place concurrently the ovaries and the uterine walls. Menstruation cycle, in fact, is a recurring cycle beginning at menarche and the ending of the menopause, in which the endometrial lining of the uterus prepares for pregnancy. If the pregnancy does not occur, the lining is shed at menstruation. The average menstruation cycle is 28 days. In that case, anterior pituitary secretes the following hormones. 1. Follicle stimulating hormone promotes the maturation of the ovarian follicles and secretion of the estrogen, leading to the ovulation, and luteinizing hormone stimulates corpus luteum and secretion of progesterone. The phases of menstruation cycle: first is proliferative stage, 10 days, then secretory stage, 14 days, then menstruation phase, 4 days. What is menopause? The cessation of menstruation is menopause. Natural menopause typically occurs within the 45 to 55 of age. It is caused by changing the concentration of sex hormone. During menopause, the ovaries become less responsive to the FSH and LH hormone, and menopause becomes irregular, eventually ceases. Accessory glands of the reproductive system is breast or mammary gland. The breasts are small until puberty. They developed in their mature size under the influence of estrogen and progesterone. During pregnancy, these hormones stimulate further growth. After the baby born, protection of the anterior pituitary stimulates the production of milk. The posterior pituitary stimulates the release of milk in response to the stimulation of the nipple by the sucking baby. The mammary glands consist of glandular tissue, fibrous tissue, and fatty tissue. Estrogen promotes the formation of mammary glands while testosterone inhibits its. Prolactin, which is stimulated by the estrogen, acts on the mammary glands to produce milk in the time of lactation. The external part of a female reproductive system is mons pubis, labia majora, labia minora, clitoris, vestibule, hymen, and greater vestibular glands. What is the male reproductive system? It includes the scutum, which contains two testes, and epididymis, a pair of vas deferens, a pair of spermatic cords, a pair of seminal vesicles, and a pair of ejaculatory ducts. Prostate gland and penis. First is scutum. It is a pouch shaped like, divided into two compartments. Each of one contains its testes and epididymis and testicular end of spermatic cord. Testes: tunica virginalis, tunica albuginea, and tunica vesiculosa. Those are three layers of tissues present in testes. Then epididymis, it is tightly coiled, thin-walled tubule, conducts sperms from the testicles to the vas deferens, presents a schematical productions of the semen. The epididymis divided into numbers of segments or regions. Initial segment: head, body, tail, and vas deferens. The epididymis provides for the storage, transmission, and maturation of sperm. A pair of vas deferences. Its name is Latin, which literally means carrying away vessel. It is long muscular tubule that passes upwards, elongated the testicles, and carries spermatozoa from the epididymis to the ejaculatory duct. Spermatic cords. These are two, one leading from each testis by suspending it on the scutum. It is composed by the fibrous tissue, smooth muscle, and connective tissue, lymph and blood vessels, nerves, and different duct. Seminal vesicles. There are two types of fibromuscular pouches lined in the columnar cells. They are sac-like structure attached to the vas deferences. At its lower end, each vesicles open into the short duct, which joins to the corresponding different duct to form the ejaculatory duct. Ejaculatory ducts, they are two tubes 2 centimeter long, each formed by the union of the duct from the seminal vesicule and different duct. They passes through the prostate gland and join the urethra. Next, prostate glands, it lies to the pelvic cavity, and ejaculatory ducts as the base of the urethra just below of the bladder. The prostate gland has an outer fibrous covering layer of smooth muscles, granular cells, columnar cells, etc. It secretes a lubricating fluid, passes into the urethra through numerous ducts. Next, urethra. The urethra is the channel that carries the semen to the outside of the body through the penis. The urethra, about which you may recall reading, it is also part of urinary system because it is also channel like structure which urine is passes and it leads to the bladder and exits out of the body. It is surrounded by the prostate gland and passes through the penetorium into the penis. There are two urethral sphincter, internal and external. The penis has the root and the body. It is formed by three erecticular muscles of the tissues and voluntary muscles. It has a rich blood supply. Growth and development during pregnancy. The placenta. The placenta during pregnancy is developing day by day and lies implanted on the uterine wall. It is connecting with the fetus through the umbilical cord. It is not a passive barrier between the mother and fetus but plays the very active role for the developing fetus. It is a sole critical route for receiving nutrients from the mother and exchange the waste products. The other two structures are amniotic sac and umbilical cord. Amniotic sac, which houses the developing fetus, and umbilical cord is a rope-like structure which contains fetal blood vessels which extended through the fetus umbilius to the placenta. The placenta evolves during the 6th to 12th week of pregnancy from the small mass of cell into the complex spongy network of tissues and blood vessels. After 12th week of pregnancy, the placenta has attained a defined form. The placenta has two principal parts, uterine and fetal. On the maternal side, the placenta is a part of uterine mucosa. When the blastocyst, an early pre-implantation embryo, implants in the uterus at 6 to 7 days of the fertilization, the uterine tissue and blood vessels break down to form small spaces that fill the maternal blood. Blood begins to circulate in the spaces about 12 days gestational. It is a relationship between maternal and fetal side. On the fetal side, the trophoblast grows the cells to root-like villi into the pools of maternal blood. These villi contain capillaries which will exchange nutrients and waste products between the mother and the fetus. Role of placenta: nourishes the fetus, removes waste, fetal lung, protective barrier, and acts as a endocrine gland. The chronological order with the progression of pregnancy, hormones are produced. Those are human chorionic gonadotrophic hormone, progesterone, human placental lactogen, chorionic somatomammotropic hormone, etc. Fetal growth and development. Firstly, zygote. The newly fertilized ovum or zygote begins as a cell. During day by day the fertilization, it divides. Within 2 weeks, the zygote embedded itself in the uterine wall. Cell division continues, and as development produces, the zygote becomes an embryo. The development of embryonic period is amazing. The number of cells at first doubles approximately every 24 hours. The size of embryo changes very little. At 8 weeks, the 1/4 inch embryo has a complete central nervous system, beating heart, and a digestive system, well defined fingers and toes, and beginning the facial features. Fetus. During the next 7 months, each organ grows to maturity on its own schedule. Fetus growth is phenomenal. Weight increases from 1 gram to about 3000 grams. Physiology of lactation. The human mammary gland consists the milk production cells and a duct system embedded in a connective tissue and fat. The basic components of the mammary glands are alveoli lined with the milk secretion epithelial cells surrounding by the myoepithelial cells and rich capillary networks. These alveoli join up to form lactiferous ducts that drain into the opening of areola. Oxytocin and prolactin are produced in the lactating process. Prolactin is responsible for milk production and oxytocin is involved in milk ejection from the breast. The basic secretory units of the mammary gland are the alveoli composed of the single layer of epithelial cells. The alveoli produces the secretory product. Surrounding the alveoli are the myoepithelial cells, which are contractile and responsible for the ejection of milk from alveoli and alveolar ducts. Disorders of the female reproductive system. Reproductive morbidity refers to the disease that affect the reproductive system, although not necessarily as a consequences of reproduction. Reproductive morbidity can be subdivided into 3 broader categories. One is obstetric or maternal morbidity, 2 is gynecological morbidity, and 3 is contraceptive morbidity. Reproductive tract infections include 3 different types of infection that affect in the reproductive tract. One is sexually transmitted infections. Reproductive tract infections include 3 different types of infection that affect the reproductive tract. One is sexually transmitted infections. These include, for example, gonorrhea, syphilis, genital herpes, genital warts, HIV, etc. They are caused by viruses, bacteria, and other microorganisms that are transmitted through the sexual activity and with an infected partner. Endogenous infections. This includes bacterial vaginosis and candidiasis, which results from the overgrowth of organisms normally present in the vagina. Next is iatrogenic infections. Those are caused by the introduction of microorganisms into the reproductive tract through the medical procedure, including unhygienic delivery conditions or wrong sanitization, such pregnancy period or menstruation irregulation, sterilization procedure, etc. Disorders of male reproductive system. Infertility is the inability of conceive after at least 1 year of unprotected intercourse. Let us know about the causes and risk factors of male infertility. The primary causes of male infertility are problems of the sperm production or delivery. Impaired production of sperm and delivery may result from hormonal dysfunction, trauma, or the defective reproductive system. Some of the causes include cystic fibrosis, ductal obstruction, hemochromatosis, taking of drugs, sexually transmitted diseases, sickle cell anemia, systemic disease like fever, infection, kidney disease, metabolic disorder, etc., testicular cancer, testicular trauma, etc. Contraception. What is contraception? Birth control by the use of devices or drugs or surgery referred to as contraception. There are various types of contraceptive methods available today. First is folk method. People have been using birth control for thousands of years. These include coitus interrupts, postcoital Dutch, breastfeeding, etc. Then traditional methods, which includes condoms, vaginal spermicides, diaphragm, vaginal contraceptive sponge, fertility awareness with family planning, etc. Modern methods includes oral contraceptive pills, progestin implants, hormonal injections, intrauterine contraceptive devices, etc. Permanent methods, tubal ligation, vasectomy, etc. The emergency contraception. ECP can be useful for preventing pregnancy in many situations, including a condom slips down or breakdowns, a diaphragm becomes dislocated, unprotected intercourse, missed to taking oral contraceptive pills. Common tests during pregnancy. First is alpha fetoprotein screening, amniocentesis, chorionic villus sampling, fetal monitoring, glucose tolerance test, group B strep culture, ultrasound, genetical screening. First is alpha fetoprotein screening. This is the blood test that measures the level of alpha fetoprotein in the mother blood during the pregnancy. AFP is a protein normally produced by the fetal liver, is present in the fluid surrounding to the fetus, which is called amniotic fluid, and crosses the placenta into the mother bloods. Abnormal levels of AFP signaling, open neural tube defects, Down syndrome, other chromosomal abnormalities, differs the abdominal walls of the fetus, twins baby, the miscalculated due date, etc. Amniocentesis. This is the procedure used to obtain the small sample of amniotic fluid and surrounds the fetus to diagnose the chromosomal disorders or neural defects such as spina bifida. Testing is available for other genetical defects and disorders depending on the family history or genetics. This test is generally offered to women between 15th to 20th weeks of pregnancy who are at increased risk of the chromosomal abnormalities. Chorionic villus sampling test, CVS. It is prenatal test. It involves taking the sample of placental tissue which contains same genetical material as the fetus and can be tested in the chromosomal abnormalities. The test is done between 16 to 18 weeks of pregnancy to screen for the neural tube defects. Fetal monitoring. During late pregnancy, the physician may want to monitor the fetal heart rate and other functions. Fetal heart rate monitoring is the method of checking the rate and rhythm of fetal heartbeat, and the average fetal heart rate is between 100 to 160 beats per minute. The fetal heart rate may change as the fetal responds to the conditions of the uterus. The abnormal fetal heart rate or pattern may mean that the fetus is not getting enough oxygen and there is other problems. Glucose tolerance test usually conducted at the 24th week to 28th week of the pregnancy measures the levels of sugars in the mom's blood. Abnormal glucose level may indicate the gestational diabetes. Group B strep culture. Streptococcus bacteria is found in the lower genital tract. GBS injection usually causes no problems in the women before the pregnancy, but can causes illness in the mother during labor. What is ultrasound? This is the usual diagnostic technique, uses in high frequency sound waves to create an image of the internal organs. A screening ultrasound is sometimes done during the course of pregnancy to check normal fetal growth and verify the due date. Ultrasounds may be performed at various times throughout the pregnancy in different regions. Genetical screening. Many genetical abnormalities can be diagnosed before the birth. Example of genetical disorders are cystic fibrosis, hemophilia, thalassemia, sickle cell anemia, polycystic kidney disease, etc.